Hi, my name is Dan Edelstein. I coordinate the Johns Hopkins Hereditary Colon Cancer Registry, where we've been studying hereditary colon cancer for the past 30 years and trying to develop new ways to diagnose and treat it. I'm here today with Dr. Jardiello, hereditary colon cancer expert, and research nurse Linda Highland. Both have been working in hereditary colon cancer for a long time. Dr. Jardiello, would you please introduce yourself?
Yes, Dan, I'm Dr. Frank Jardiello, and I've been right now I'm a professor of medicine at Johns Hopkins. I've been here for 27 years, and during most of that time studying the prevention of colorectal cancer and the polyposis syndromes.
Great. And Linda, could you tell us a little bit about yourself, please?
Yes, I'm Linda Highland. I'm a research nurse. I've been a research nurse for the last 24 years, and about 22 of them working with Dr. Jardiello on hereditary colon cancer studies.
Excellent. So today we're here to talk about a new study, Curcumin, and in the treatment of FAP.
Right.
So, Dr. Jardiello, the first question I have for you is, what exactly is curcumin?
Well, that's a good question, Dan. Curcumin is a spice, essentially. It comes from the Curcuma longa plant. You take the roots of that plant, you grind the roots up, and you get turmeric, which is a spice. And then you take turmeric and you extract it with alcohol, and you get in the alcohol curcumin. And curcumin is a spice that's been used in Asia for generations, not only as a spice but also as an anti-inflammatory compound to prevent wound healing, for example, in wound healing.
That's it. So the connection then between colon cancer and curcumin, in my mind, is that it's somewhat of an anti-inflammatory compound, similar to aspirin or Celebrex.
Right. That's it. That's exactly right. So in the past, we've studied Slindac, and we've shown in our past studies that that anti-inflammatory drug regresses adenomas in patients that have FAP. And others have looked at Celebrex, which is another anti-inflammatory drug, and shown that although it's less effective, it does regress adenomas as well. So curcumin is another anti-inflammatory drug.
That's it.
Or anti-inflammatory compound.
And what differentiates it from, say, Slindac and aspirin is that it's a natural substance. It's been used for hundreds of years in India and Asia. So generally considered to be a safe compound.
Right. Since it's a food additive, it's thought to be a safe compound. And we know that patients have gotten lots of curcumin in other studies for other things, up to 8 grams, with very little in the way of side effects. And this is probably because when you take curcumin by mouth, it really doesn't get well absorbed. It stays in the intestinal tract and not in the bloodstream. And that's important to us because we want it in the intestinal tract to treat the polyps in the intestinal tract. So that we see as an advantage to use this spice.
And so you've actually studied this previously and shown that there is a relationship between curcumin and individuals with FAP in the sense that it can prevent polyps. Right.
So my colleague, Dr. Marcia Cruz Correa, and myself have used this compound on a few FAP patients, a handful of FAP patients, and we thought we could see regression or resolution of these adenomatous polyps. Also, this compound has been used in animals. There are animal models of FAP. For example, mice can have a condition that looks like FAP, and if you give mice curcumin, those polyps in the mice can go away. So we have relatively strong data that this could be an effective compound in FAP.
Sounds exciting. And that's why we're here today, to talk about a new study that's going to look at a larger patient population of individuals with FAP who could potentially participate in helping us find more information out about curcumin. So Linda, could you tell us a little bit about who might be eligible for this study?
Sure. Anyone who is 18 to 85 years old who has to have a diagnosis of FAP, familial adenomatous polyposis, or attenuated FAP.
Okay. And most individuals with FAP have had colon surgery or part of their colon removed. Are they still eligible to be in this study?
Yes, they are. You can have a subtotal colectomy with the ileorectal anastomosis, or you can have a total colectomy with the ileal anal pull-through, otherwise known as a J pouch, or you could have an intact colon. And you also have to have some polyps in that lower tract to be eligible for the study.
Okay.
Because the study involves seeing whether the polyps go away, so you need to have a few to see if they go away if you take the curcumin or the placebo.
I see. Okay. Okay, so it sounds like most individuals with FAP could potentially participate in this study, as long as they have polyps.
Yes.
So are there any, is there any criteria or any reason why they couldn't participate?
Well, we do have some inclusion-exclusion criteria, but if someone is eligible, they can contact us and we can discuss the particulars of the study with them and see if they're eligible for the study.
Great. And so the study is here at Johns Hopkins. Is it anywhere else?
So we have two sites, Dan. The first is here in Baltimore, Johns Hopkins, with Linda and myself. And then we have a second site at the University of Puerto Rico with Dr. Cruz Correa, also running the study there as well.
Excellent. So, so patients could contact Linda, and depending on where they live, they could either be directed to Puerto Rico or here in Baltimore.
Yes.
Okay. All right. And so we'll share the contact information for both sites, and for Linda, her email and her phone number. And then I look forward to speaking to both of you about some of the specifics about the study.
Okay.
So thank you very much for your time.
It was nice to be with you, Dan.
Yes, thank you.